nearly 14,000 people living with HIV/AIDS in the state are facing acute shortage of the life-saving antiretroviral or ARV drug since April this year. One of the Manipur network of positive people highlighted that although the state has been facing shortage of ARV drugs from time to time since rolling out of free antiretroviral therapy in 2004, it is for the first time that the patients are being deprived of life-saving drug for such an extended period. It may be mentioned here that as many as 8 civil voluntary organizations and NGOs working in the field of public health and for the welfare of the people in Manipur yesterday convened a meeting in Imphal and have mounted pressure on the government to immediately act to ease the plights confronting the people living with HIV/AIDS. Speaking to media, the Manipur Network of Positive People group members said that the problem came up after Manipur State AIDS Control Society was asked to procure the medicines which were earlier supplied by National AIDS Control Organization. He further said that the people are required to take the drug on the prescribed time each day, and a delay of even a minute could increase the viral load, thereby threatening the life and well-being of the patients. Owing to the shortage, many adults are being given pediatric drugs while children are being prescribed drug meant for adults but in reduced doses.
The meeting agenda was out of stock of ARV medicine, which is called ART, taken by the HIV positive peoples. It is to be taken for every day in adherence. It has to be in timely to take. So the problem happened was that from the last month of April, this 2022, the ARV has become a little shortage, and then nearly around 13,000 above, let's say 14,000. 14,000 people have been taken ARV in the state of Manipur so far. Problem is that we have different categories, different regimes of ARV medicine, different names, different grams, whatever. So now the problem starts is that when the National AIDS Control Organization asks to procure the medicine themselves by the states itself. That's how the problem starts. Before, there's not much problem. Now when the NACO has instructed to the State AIDS Control Society to procure the drugs by the state itself. So this is how the problem starts. Now what actually happened is that amongst our friends, I being as HIV positive, we the people living with HIV and AIDS has been facing is that the reason that which we are taking for every individual, we have different reasons we are taking. So some of them have been doesn't get the reason that they are taking. Pediatric drugs has been given to the adults. The adult drugs are given to the pediatrics. This is how that is being happening from the last April. So we have been asked to the State AIDS Control Society for nearly 3-4 times, meet the project director, meet the health minister, whatever related BIPs or related peoples so far. And still now the problem is not yet solved. So we are requesting to the government of Manipur, if possible, if the drugs are being available as soon as possible, so that the people living with HIV and AIDS become with dignity, with good health, so that the target of the World Health Organization 95 is being achieved, and U is called to you also achieve, so that Manipur doesn't have any HIV positive people in the future.
Worth mentioning here that Team Northeast Live also went to seek clarifications from the Manipur State AIDS Control Society, but the concerned officials were on leave.